Welcome to the Gotham Acupuncture Podcast. I'm Joshua Garcia, your host, and as always, I'm with Dr. Peter Karen. With his expertise in acupuncture, we'll delve into its versatility, discussing its integration into wellness routines and potential benefits from various health concerns. Without delay, let's welcome Dr. Peter Karen. Hello, Dr. Karen. How are you
Hello,
doing?
Josh. Thank you for the introduction. I've been doing well. We're enjoying some good weather in New York here right now. Nice to see the patients responding well. Happy.
That's amazing. And to start off, Dr. Karen, can acupuncture be seamlessly integrated into a wellness routine for individuals without specific health concerns?
Absolutely. Acupuncture can break into two different main categories: the treatment of disease, as in what we do when someone comes to us who's sick, who has a physical problem, and preservation of health, which is how we approach people who don't have major complaints but want to maintain a healthy lifestyle or optimize performance. This has become very popular among athletes these days. You'll often see cupping marks on professional athletes, circular bruises. But at this point, most people who are engaged in high performance activities incorporate, or at least consider incorporating, wellness into their routines. Acupuncture into their wellness routines. Sorry.
Wow, that's fantastic to know. And now let's explore the realm of respiratory conditions. Can acupuncture be beneficial for managing symptoms of conditions like asthma?
Absolutely. There's a few different things that go into most respiratory conditions. Some of them, like, say, bacterial issues within the physical lungs themselves, are better addressed through herbs and through Western medicine. But many respiratory conditions, including asthma, are triggered by stress, by posture, and by tension in the diaphragm and other related muscles. Because of this very physical cause of these internal medical conditions, acupuncture is able to make a huge and rapid difference for most people suffering from respiratory issues.
Wow, I didn't do that. Thank you for sharing about it, Dr. Karen. And moving on to a topic that might be less known, addiction recovery. Can acupuncture be utilized in addiction recovery or as part of a substance abuse treatment plan?
At this point in the United States in 2024, most addiction recovery centers incorporate acupuncture into their wellness routine. On its own, acupuncture is not enough to help most addicts recover from their disease. A combination of acupuncture, psychotherapy, cognitive behavioral therapy, and group sessions tends to work the best.
Mhm.
However, many of these talk related interventions don't address the physical aspect that addiction plays. Whether we're talking about helping people to re regulate their dopaminergic systems, their dopamine systems in their body, helping them to process trauma, helping them to reset basic rhythms like a wake sleep rhythm, we're able to do a lot to make the addict's life easier, which makes the addiction less appealing, which then makes it easier for them to quit and move on to something that's a has a better outcome.
Yes, and can you elaborate on a little bit of scientific side on how can acupuncture help addicts, Dr. Karen?
Sure. So if we're thinking about this from a Western medical and largely a neurological perspective, we see the function of the addiction is in regulating neurotransmitters in the brain and regulating stress and in regulating pleasure centers. We would often, one of the ways this is discussed is the drugs are doing a good job of what it is they're trying to do. It's just that what they're trying to do has major side effects that cause damage to the person's well being. So, a person who's an alcoholic may be able to escape some of the stress that they're carrying, some of the things that they otherwise can't cope with through the consumption of alcohol. On that level, the alcohol is doing a good job. The downside is in all the physical damage that the alcohol does, in the hangover the person has, and in the ways that it can warp and change their behavior. Over time, the addiction is another way of saying a reliance upon these coping strategies. Through acupuncture, we're able to begin substituting new coping strategies, new ways of stress management into the person's life. This is why I like to combine it with cognitive behavioral therapy, which allows them to encounter and then address the stressors which cause the need for addictive compensation. So when we're doing acupuncture, we're trying to rewire the way the person's body processes stress in the first place so that addiction becomes less necessary.
Wow, that's so fascinating. Thank you for explaining it in a scientific way. Because I also know that most of our viewers are interested in those type of topics. And now let's explore the realm of dermatology. Can acupuncture be beneficial for managing symptoms of skin conditions such as eczema or psoriasis?
Absolutely. Both eczema and psoriasis can be helped quite a bit by acupuncture, though I find that these are both conditions that are helped more through an herbal and a dietary approach.
Mm.
We still use the same Chinese medicine principles when addressing health concerns through non acupuncture interventions like herbs and diet. But when we're dealing with skin issues, we often want to adjust the physical ingredients that the person's body has to work with. If there's an inflammatory aspect, if there's a stress aspect, we can certainly address those things through acupuncture. But if there's, say, a fungal condition or a bacterial skin condition involved in what they're experiencing, in something like toe fungus, athlete's foot, vitiligo, these sorts of conditions, it works much better when we're giving the person both internal herbs and herbs to apply to the problem area. So, acupuncture may not be the best intervention for dermatological conditions, but Chinese medicine as a whole has a lot to offer. Unfortunately, within Western medicine, there's a limited number of options. Most people end up getting steroid creams and antibiotics as the
Yeah.
primary interventions for dermatological conditions. For some people, these interventions work wonderfully, and that's great. But if you found that these interventions don't work very well for you, come give us a try. See what we can do to help you out.
Yes, definitely. And also, as always, excellent insights, Dr. Karen. And lastly, let's talk about TMJ disorders. Can acupuncture be beneficial for managing symptoms in this specific area?
Or TMJ, you
Yes,
said?
TMJ.
Yeah. So transmandibular joint dysfunction or jaw pain, really, is a very common condition, especially for people who live higher stress lifestyles. Me, having a practice in New York, see a lot. My practice has quite a few people who are higher stress. So whether someone is grinding their teeth at night or has jaw pain or has general mouth dysfunction causing pain, acupuncture has a lot that we can do about this. On a very physical level, we can help to adjust the positioning of the physical joint itself. We can adjust functioning in the masseter muscle, which controls the closing of the mouth and therefore it has a lot to do with the grinding of teeth. We can help to lower stress levels so that people don't feel the need to grind in the first place. And in more Chinese medicine language, we can use sinew treatments for the front of the body that help to relax not just the jaw, but the entire anterior muscle plane, which helps people let go of a ton of tension and often allows them to no longer need mouth guards at night.
And why do people grind their teeth at night?
Oh boy, there's a bunch of different reasons for it. The shortest answer is stress.
Stress.
Stress that the person is working through and processing while they're sleeping. Somewhat
Oh.
similar to, say, a pet running in its place in sleep at night or growling at something that isn't there. People are working out frustration by grinding their teeth while they're sleeping. We see this in the Chinese medicine perspective as an inappropriate rising upwards of energy at a time when they should be resting. So we see one of the consequences of this grinding as poorer quality sleep. So we often try to calm and sedate the person's energy so that this grinding doesn't happen, which tends to allow them to go into much deeper sleep as well. And if they're more rested, they're more recovered from their stress and they become more resilient to future stress, which makes it less likely that they'll start grinding again.
Oh, okay. That's why I got it. So yeah, as always, thank you so much, Dr. Karen, for shedding light on this diverse application of acupuncture from wellness routines to specific health concerns. So yeah, until next time, this is Josh and Dr. Peter Karen. Goodbye, everyone.
Thanks, Josh. Take care, everybody.
Thank you. Goodbye.